Hi, my name is Gene Liu and I'm an otolaryngologist head and neck surgeon, otherwise known as an ear, nose, and throat doctor here in Los Angeles. And I wanted today to talk about tonsillectomies and post-tonsillectomy bleeding. Taking out someone's tonsils is still one of the most common surgical procedures that's done in the United States every year. It can be done for a variety of different reasons, but the end result after that 10 or 15 minute surgery is that you have open raw areas in the back of the throat that need to heal. As it's healing, it might bleed. Think of it like falling down and scraping your elbow. There's a little bit of a road rash. You can't close it, you can't cover it, you can't stitch it. It heals with a scab. Gradually, over about a 2 week period, skin relines the area, scab falls off. As that happens, there may sometimes be bleeding. The actual amount of bleeding in the operating room tends to only be about a teaspoon, virtually nothing. But post-operatively, at any point from the moment you hit the recovery room all the way till the last piece of scab is gone, which is usually about 2 weeks later, it is possible that you start coughing and spitting out blood. Thankfully, that only happens about 3% of the time, or 3 patients out of 100, which means 97 patients out of 100 don't have anything red coming out at all. If you happen to be the unlucky 3%, most of the time the bleeding is quite mild. You might just be coughing or spitting up little specks of red in your phlegm. If you're the 3%, most of the time we can get it to stop with something cold, either gargling with ice water, sucking on ice chips or popsicles. The cold temperature gets the blood vessels to clamp down. Now 1% of the time, or 1 patient out of 100, the bleeding continues or is dramatic or aggressive enough. In those cases, in a cooperative older child or an adult, it's like going to the dentist. You come into the office or the emergency room, and usually we can reach into the back of the throat and cauterize or stitch or do something to get it to stop. In small children, and even some adults who have a hypersensitive gag reflex, where there may be some anxiety, we can't get to the back of the throat, it is possible that we need to go back to sleep under anesthesia for 5 minutes just to get into the throat. Again, that's about 1 in 100 patients. Certainly not a high number, but not zero. Another important note is that because the bleeding risk lasts for about 2 weeks post-operatively until the last little piece of scab is gone, during that time we don't want you on an airplane, we don't want you on a boat, and we don't want people camping in the middle of nowhere. Basically, if you happen to be the unlucky few percent where there's bleeding, we want you on the ground near civilization and near healthcare should anything happen. The last place you want to be is on a cruise or in 30,000 feet in the air, where there can be a significant delay in getting to care. Sometimes we get asked by family members or parents if they could donate blood and have it on hold for the patient if they should develop bleeding. As with any blood donors, the blood would still need to be screened to make sure that it's the right blood type, that there are no infections, and no reasons why the blood can't be used. But another obstacle is that the blood needs to be held on for over 2 weeks during the entire post-operative period in case anything should happen. It's not something that we usually worry about in the operating room. The 3% risk of any bleeding and the 1% risk of needing something done is if you're doing everything right. Certainly there are situations or circumstances where the bleeding risk may be higher. If you or your family has a history of bleeding disorders like hemophilia or von Willebrand's disease, certainly let your doctor know before surgery. There may need to be things that are managed differently in the perioperative process. Additionally, if you introduce foods that are too solid, too crunchy, too sharp, too scratchy, or even too hot in temperature too early in the healing process, that can increase the risk of bleeding. We also want people to avoid any strenuous physical activity. Anything that gives you a sudden surge in blood pressure or heart rate, and certainly anything that gets your blood pressure up too high and the little veins in your head popping out, that's going to increase the risk of bleeding in the back of the throat as well. So try not to do anything too strenuous. That having been said, we absolutely want people not to lounge around on the sofa or in bed all day long. That gives you a risk of blood clots. We want you to get up, we want you to get around. It's okay to do some light physical activity, things to get the juices flowing a little bit. We just don't want those little blood vessels and veins in your head popping out. I also wanted to go back to the bleeding in the operating room. I mentioned earlier that it typically is a teaspoon or less. Again, that's true if you don't have any history of bleeding disorders, but we also want to make sure that you're not taking too much aspirin, Advil, Motrin, ibuprofen preoperatively for a few weeks. If you're on those type of medications, and certainly if you're on Coumadin or warfarin, it can dramatically increase the risk of bleeding in the operating room. Also, there are some vitamins and supplements that may increase the risk of bleeding, so please talk to your surgeon prior to surgery about what you're taking. I hope this information helps and clears up some of the concerns around bleeding after tonsillectomy. Most people are highly concerned about the pain and discomfort and the horror stories they've heard from family and friends. Medically, as a surgeon, what I actually worry about most is how to manage bleeding.